Hi, I'm Stephanie Melendez, and today I will be talking about a 7-year-old boy named Tony who's diagnosed with low vision of the right eye along with color deficiency of the right eye as well. He's currently in 2nd grade, and his parents have concerns with his functional activities in school and at home as well. The occupational concerns that are for Tony are getting dressed. He has a difficult time when it comes to manipulating clothing items such as zippers and buttons. And he also has a hard time being able to tell what side is front and back of shirts or pants. The other concern that they have is his writing. Due to his low vision, he's having a hard time placing the letters on the line on paper, and as well as knowing the formation of the letters, which is going to be impacting his school occupation of a student. His strengths are that he's able to verbally say what he needs and what he wants. So whenever he has some issues with a task, he's able to tell the parent or the therapist or the teacher what he needs help with. He's also able to follow verbal directions when it's a familiar task that he's done before. 3 underlying factors that are with low vision are going to be color and contrast discrimination, the ability to use bilateral coordination, and as well as copying images visually from far points. These are all going to affect Tony's daily life activities because he has to do a lot of these skills and needs them in order to complete his activities of daily living. So for example, the color and contrast discrimination, he's going to have to know when he's navigating throughout his environment. And he's going to have to be able to tell where the different thresholds are. And if he has color and contrast discrimination, he's going to have a hard time with this. An intervention that can be used for this is identifying what color he can identify the best and placing tape of that color on thresholds and in the classroom floor to help him navigate through the classroom. The 2 frame of references that are ideal for Tony's case are the frame of reference of visual perception and the occupational adaptation. The frame of reference of visual perception will help identify what he needs as a modification or adaptation in the task that he's struggling with. So this frame of reference will help the intervention plan for coming up with ideas on how to enhance the environment for him to be able to use his occupational performance and engage with those activities. The occupational adaptation will benefit Tony's case because it'll help find ways and methods for him to complete his occupation. The occupational adaptation is all about mastering the activities and being able to use occupational performance with a task. So Tony will improve his occupational performance with efficiency, effectiveness, and satisfaction when provided with the needed adaptations that will help increase his participation. The top-down approach for this case study would be the Miller Function and Participation Scale. This assessment looks at school-related tasks that have to do with visual, fine motor, and gross motor skills. So this will be good for Tony to be able to identify where Tony is lacking the skills such as for hand function and visual perception abilities. The appropriate bottom-up assessment in this case study would be the Peabody Developmental Motor Scale, the PDMS, because it looks at grasping, visual motor integration, reflexes, stationary, locomotion, and object manipulation. So of course, grasping, visual motor integration, and object manipulation will be ideal for Tony's case because he's struggling in the areas of using fine motor skills to be able to manipulate the objects that he needs in order to dress himself or in the classroom when it comes to writing. And the locomotion will help as well to identify if he needs any kind of adaptations or modifications in his environment to help him navigate throughout the environment. The two occupational outcomes that are predicted with Tony's case are that he will improve his writing when engaging in classroom activities with the teacher, so such as copying what she's writing on the board and going along with it. The other one would be his improvement of occupational object manipulation in order to help him with self-care tasks, because as expected, he will have to become more independent as he gets older, so he needs to be able to do more of the ADLs independently with modification or adaptations or training. The two goals for Tony will improve visual perception skills by writing one sentence with accuracy with 3 verbal cues to assist with placement of letters information on low vision writing paper with bold lines for 4 out of 8 opportunities within 6 months. Second goal is Tony will improve object manipulation skills by demonstrating that he can button and unbutton 5 medium buttons within 30 seconds with 3 visual cues to both his hands to assist him when finding the hole of the button within 6 months. And that is it on Tony. Thank you very much.